Okay, this is chapter 2 of the book, John Mcdougall, the Doctor Who Fought for You. So it starts out, I think we're on like page 18. Okay, who is John Mcdougall? He's the greatest doctor who ever lived because he cured more patients than anyone else. And that's based on the idea that, Kempner saw about, I think, 19,000 patients. Mcdougall only saw about 12,000 patients in his clinic, but Mcdougall helped so many other patients through his books and through his telehealth that it's more than Kempner. Okay, Mcdougall was born in 1947 in the USA to a Scots-Irish family, very close with his parents. He died in 2024 at 77 years old. As a freshman in college, he was fat, cigarette smoker, and when he was 18 years old, he had a stroke with paralysis on the left side of the body, left hemiplegia transient. He made a near complete recovery from the stroke, other than a little residual mild left-sided weakness. The stroke motivated him to decide to go to medical school. His nickname became Dr. Potato, very fitting for an Irishman, and he now teaches people that potatoes are the best food in the world. He actually thinks sweet potatoes are probably the best food in the world, but he said if he was stranded on a desert island and he only had one food, it would be a potato. And that's because potato is a tuber, it grows underground, a tuber, and it's nutritionally complete. The only thing it's missing is, vitamin B12. Best vitamin B12 is methylcobalamin. Okay, he also says that's unlike grains, things that grow above the other starches that grow above the ground. They tend to be short on vitamin A and vitamin C. Okay, his wife, love of his life, was Mary Mcdougall. He met her when she was working as a surgical nurse, and he was a medical student working, as a OR technician to help out there, make some money, pay for school. He did his internship, first year of residency in Hawaii in 1972. And he did a lot of things to really fight for the patient that were not in his financial interest. It's like the quote from 2 Timothy chapter 4, verse 7. I have fought the good fight. I have finished the race. I have kept the faith. Here's a Mcdougall quote. I respond to emails from patients, and I used to respond to snail mail letters because otherwise I'm as lonely as a Maytag repairman because my patients get well. Yeah, that's another thing most people don't understand, that all these diseases that are called the chronic Western diseases, the reason they're called chronic is because under normal conventional medicine treatment, the patient never gets better. The cure rate is 0 of conventional medicine for hypertension, diabetes, autoimmune disease. You can't cure a dietary disease with a pill. Okay? Here's a nice painting, Godspeed, by Edmund Layton from 1900. It's analogous to John and Mary. John and Mary rings a bell. They should have a university, John and Mary. Okay, dedicated to nutrition and health. Anyways, I love that painting and them. Isn't that great? Okay, the first priority of the medical system is not to help patients. That's what I see. Like whenever I see some patient, like say, oh, isn't it wonderful all the things modern medicine can do? I mean, I have to hold in my laughter. Because I know a lot of patients, they're real gullible and they see these modern hospitals, these fancy buildings. They're like the equivalent of the cathedral of, 1,000 years ago. In the minds of the patient, they think science is the real church of truth, and they're just stupid. They don't understand. All this medical stuff, it's not designed to help the patients. It's designed to make money off them. If something helps a patient but it doesn't make money, you're not going to hear about it. Okay, and some people say, oh, how could I be cynical? Look, I've been a doctor over 30 years. I'm from a family doctor. I know medicine backwards and forwards, okay? It's in my blood. And I can tell you this, the low-fat, low-sodium, vegan diet based on starch can cure 1,000 more times than anything in those fancy buildings. And you never hear about it because there's no money in it, okay? It's important to understand that because once the patient understands in their mind's eye that the system is not there to help them, then they've got a chance. I can tell you, almost these patients never get better. It's like a big joke. Okay, but if you know in your mind the system doesn't care about you, it's just there to generate profit. But on the other hand, it does have something valuable. There are some doctors with very valuable knowledge that can help you. And so sometimes you do need to seek that out. And it's really good for acute problems, for trauma, for a lot of infections. Okay, that's great. For end-stage stuff, like put a patient on dialysis, do a hip replacement when necessary. That's all great. But the vast majority of people, like 70% or more, it's just, this chronic stuff because they eat the wrong diet. And also they're more and more exposed to toxins. So, you need to learn about it. Okay, doctors are not obligated to really try to help the patient. They're obligated to provide the standard of care, generate a billing code. And when they generate a billing code, they get paid. Everybody gets paid. Typically, it's a prescription. The pharmacy makes money. Everybody's making money because they're following the standard of care. They can't get sued. Okay, and there's always some bean counter on the doctor's butt. How many patients did you see today? How many billing codes did you generate today? So they always have to go fast. They always have to rush the patient as much as possible, because if they don't, the bean counter is going to be on their case, and the bean counter is going to be comparing them to the other doctors. They're going to say, well, gee, how come the other doctors in the group saw 30 patients today, you only saw 15? You're goofing off. You're not pulling your weight. You better start pulling your weight, seeing your share of patients, or we're going to have to let you go. So the pressure, it's never going to change. It can't change because it doesn't want to change. If you were making $1 billion and more every year off all these chumps, would you want to change the system? No, you wouldn't want to change anything. And that's why conventional medicine hates smart people like Dr. Mcdougall, because they try to change things. They try to make things better for the patients. That is not welcome. If you cure a patient, you lose a customer. You want them match the ill to the pill, send a bill, keep them hooked on drugs every day. This is high society drug dealing. That's what it is. And if you don't know that, then you don't know much. Okay, in reality, standard of care is drug-based medicine. And it's the lowest common denominator. It's like animal medicine. You could give a pill to a dog, okay? It takes a human, an intelligent person to say, well, gee, I will change my diet. Gee, I will change my behavior. I will stop exposing myself to toxins. I will exercise. I will get my sleep. I will quit coffee and alcohol and tobacco. Okay, that requires intelligence, curiosity, and discipline. It's a higher level. Okay, and you have to have a standard of care for all the demented people, the stupid people, the drug addicts, the intoxicated people, the unconscious people, and there's a lot of them. Okay, so there has to be a standard for them. But remember, that's the lowest common denominator typically. Quite often there's something higher, and that's what you want. Okay, here's the dedication. Making a commitment. John had a big talk with his family and got the agreement from Mary that they would go down this route. Okay. Oh, and then here's the other thing I think is funny. A lot of people, they're like, oh, well, artificial intelligence, there's science. That's going to improve medicine. I'm like, are you kidding me? It's another joke. Who do you think's going to write artificial intelligence? The drug companies are going to write it. And what's it going to say? Prescribe more drugs. Of course it is, okay? All this AI, it's a joke. You have to understand, and I've told you before, I'm not even going to get into all that philosophical stuff. Okay, here is the accolade. The knight is knighted. He finished his internship, went back to complete a residency, get some more training, see if he could learn something more. And something big did happen. He got to meet Dr. Burkett, and Dr. Burkett, tuned him in that nutrition is pretty important for health. Okay, the other thing, too, is you have to look at who's got the money. Money talks, BS walks, and basically the drug company's got the money. But it's not just the drug company, it's the entire system. There's the surgical device manufacturers. They make pacemakers, they make the prostheses for, doing hip replacements, knee replacements, shoulder replacements. Surgical companies that make, spinal cord, spinal canal implanted stimulators, the pedicle screws for fusion surgery. There's a lot of stuff. Okay, so anyways, they're all making money off it. The device makers, the ones that make the CAT scan machines, the MRI machines, the ultrasound machines, the for-profit hospital corporations, chains of hospitals, the insurance companies too. Even the insurance companies are in on it. So what I'm trying to say is, everybody wants the patient to pay as much as possible except the patient. Everybody's in on it. Okay, and the doctors are really just pawns. They tend to be conformist, hardworking people, but they don't tend to know very much. Okay, and that's the other thing too. People will say to me, oh, well, doctors know a lot. How could you say that? They went to pre-med for 4 years, medical school for 4 years. That's 8 years, and the average residency is 4 years. They got 12 years of training. How could they not know a lot? The reason is they don't learn the things they need to know. They need to know nutrition, epidemiology, and toxicology. That's what real disease, the vast majority, at least 80% of it's based on. And they don't get any training in those things. So it's like they ignore it. That'd be like teaching people how to play basketball, but not teaching them how to dribble. Okay, teaching them to play baseball, but not how to pitch and catch. Okay, it's ridiculous. And they somehow get them through without realizing. I didn't realize it. I thought I was a well-trained doctor. And then all of a sudden I'm like, why am I fat? Why are my parents sick? How come the system can't do anything to help us? Then I started reading. I learned and figured out all this stuff. And you look at the money. For example, Mcdougall tried to get approval for the insurance companies to pay for a 1-week therapy of coronary artery disease, and for a fee of about $4,000. And he felt that almost all of these patients could easily be cured if they actually followed the diet. But the insurance companies would not go for it. And if you look at the money, you know, for a stent, they get $20,000, $30,000 a piece. For CABG, coronary artery bypass graft, open heart surgery of coronary artery disease, $100,000, $150,000, depending on how you look at the billing, you know, including the surgical fee, the operating room, the surgical ICU follow-up. And the insurance company basically told them, look, the bigger the payment, you know, we get a piece of the pie, the more money we get. So they had no interest in it, none. And so what I'm going to say, you know, what a poor thing. I feel so sorry for the patient. Everybody benefits except the patient by constantly driving up the cost. That's why USA prescribes more drugs and has a more expensive system than any other place, despite not having healthier patients. Okay. The system considers the patient to be a moron. Okay. And so, you know, if you walk in there trusting the system, you're going to get chumped. There's a high likelihood you're going to get chumped. Okay, I like this quote by Thomas Carlyle. There's always a good reason, and then there's the real reason. Okay? The other thing, too, is you'll hear all these doctors, all these hospitals talk about ethics, ethics, ethics. You know what? How many doctors have seen my lectures? Tons of them. Many, many thousands, hundreds of thousands. How many have ever invited me to give a presentation at a hospital over the internet? Zero. Zero. No one ever invites me to speak in a conventional medical setting, ever. Okay, so, because it's not good for business. The business is selling drugs. Somebody comes in and says diet actually helps. That's not good for business. Okay, well, I'm trying to get this into your mind because I'm trying to give you a chance. All I see is all these pathetic, sick old people. You know, all these people come to me and they want something magic, you know. You start talking nutrition to them and their eyes wax over. They think you're BSing them. It's frustrating. I get friends of family, friends of doctors' families, relatives, all these people come to me, and it's like the vast majority of them don't want to hear this diet, nutrition, lifestyle stuff. And I'm like, well, look, there is no magic pill. You want me to do a rain dance or something? Okay. Cast a magic spell on the pill? Okay. It's BS. It doesn't exist. All right. Okay, so, you know, and then how did this work for Mcdougall? Because of Mcdougall's efforts to treat with a diet-based approach, he never got sent a single patient at his hospital. No one would ever refer him a patient. The doctors themselves, the doctors would send their family members, but they would never send a regular patient to him. Okay, here is Reception at the Court of Versailles, painting by Jean-Léon Gérôme from 1878. And it pretty much sums up what it's like. You know, you got the entire system all stacked against you, looking at you as an oddball if you try to do something unconventional that doesn't generate money. Here's a nice quote by Rudolf Carnap. He says, if one is interested in the relations between fields, which according to customary academic divisions belong to different departments, then he will not be welcomed as a builder of bridges, as he might have expected, but he will rather be regarded by both sides as an outsider and a troublesome intruder. Okay, so what I'm getting at there is the different medical fields tend to be very much siloed, separate from each other. And each one says, this is your turf, this is your turf. Nobody likes it when there's a turf battle over something both groups can do, like lower extremity angioplasty. Cardiologists want it, vascular surgeons want it, interventional radiologists used to control it. So anyways, they try to avoid turf battles, and each one just sticks to its turf. But the problem is a lot of complex medical problems require reading and thinking across what is considered separate specialties. And unless you do that, you can't cure those patients. Okay, the other doctors knew Mcdougall's methods were working. They would see patients whose atherosclerosis had resolved on coronary arteriograms, on lower extremity leg arteriograms, and that the patients clinically had improved. Their exercise tolerance, walking capacity had improved. So they knew what Mcdougall was doing would work. And again, they would go to him themselves and send their family, but they would not send the regular patients. Other low-fat vegan doctors have had the same experience, like Caldwell Esselstyn, where he was successfully treating all these patients, but they wouldn't allow him to have a clinic for a long time at the Cleveland Clinic until he had to use like legal pressures. I can also tell you, I have the same thing. I got doctors that come to me, they want me to explain to them how to help them solve the clinical problems in their own field for themselves and their families, but they will never invite me to speak. So anyways, that's where we'll stop for today. We'll continue with this next time. Hope that was helpful.